Today's world of healthcare offers an endless array of options, but do you fully understand the options that are available to you? Let's take a closer look at traditional hospitals versus surgical hospitals to have a better understanding of which type of facility you should choose. Surgical hospitals. Surgical hospitals are similar to ambulatory surgery centers, ASCs, in that they are freestanding healthcare facilities, often physician-owned and led, that specialize in providing surgical care. Surgical hospitals, however, go above the outpatient surgical offerings of an ambulatory surgical center and also provide inpatient surgery options for certain medical needs and conditions, like joint replacement, for example. Surgical hospital eligibility. Individuals seeking potential treatment at a surgical hospital should be in good overall health and require a minimally invasive or low-risk procedure. People who need invasive or high-risk surgery, are obese, or have had previous cardiac intervention should consult with their physician before scheduling their procedure at a surgical center or surgical hospital. While surgical hospitals are required to have an emergency plan in place, they do not have a full emergency room on site and cannot accommodate unplanned surgical scenarios. Factors to consider. What should you consider when deciding between your two options? To begin, you should consider the type of surgery. Common procedures in a surgical hospital include specialties like ophthalmology, gastroenterology, gynecology, otolaryngology, orthopedic surgery, and pain management. The second thing worth considering is location. If you need an inpatient procedure, you will likely have at least 1 day of recovery on site, so location may not be as much of a concern. However, if your surgery is outpatient, you will leave the facility the same day. Other factors to look over include the surgical time frame and how quickly your procedure can be coordinated. You'll also want to consider the cost, which, if you didn't know, can be significantly less in a surgical hospital setting. Surgical hospital benefits. According to the Center for Disease Control and Prevention, the surgical hospital setting is often safer and cleaner, reducing the risk of infection by nearly half as compared to a traditional hospital setting. Additionally, surgeries are often completed faster and the recovery period is typically shorter. What other benefits will you enjoy by using a surgical hospital as opposed to a traditional hospital? Surgical hospitals have a better nurse-to-patient ratio because they are providing care to fewer patients at once, which equates to more personalized attention. You will also receive faster scheduling. Delays are not common in surgical hospitals because emergency procedures do not occur. Additionally, physicians can assemble specialized surgical teams easily, giving them more control over the surgical atmosphere and ultimately provide more expert, efficient care. Choosing a surgical facility is ultimately a case-by-case situation, but procedures conducted outside of a traditional hospital can be a safe, affordable option for many people. However, be sure to discuss your options with a medical professional. Consider all factors that may come into play, like past surgical complications, heart conditions, and a need for high-risk interventions. Wondering if you're a candidate for surgery at one of the Edgewood Surgical Hospital locations? Call or message our staff to see if you qualify.